Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What to eat when you have C. Diff Clostridioides Difficile. A C. Diff Clostridioides Difficile diet may help alleviate diarrhea, the primary symptom that is associated with this bacterial infection. /r/n/n Clostridioides difficile, previously known as Clostridium difficile, is a highly contagious organism that primarily impacts people over age 65, particularly those who are taking antibiotics and are in the hospital or living in a facility such as a senior care center. /r/n/r/n A soft diet, with foods that are easy to chew and swallow, that includes soluble fiber while avoiding foods high in insoluble fiber, such as nuts and seeds, may help promote digestion. However, there is a lack of definitive evidence from medical research studies to prove the best type of diet. /r/n/r/n Although there is limited research on the effectiveness of diet for alleviating symptoms of C. diff, researchers know quite a bit about foods that worsen or alleviate diarrhea. /r/n/r/n The C. diff diet is comprised of foods that help to alleviate or lessen diarrhea. Initially, your healthcare provider may recommend a diet of clear fluids, but this diet can only be implemented safely for a few days. It may take up to 2 weeks for a bout of C. diff to respond to treatment and for diarrhea to clear up. /r/n/r/n In the interim, while waiting for treatment to be effective, many people with C. diff eat a diet of foods that won't worsen symptoms, and that may help lessen the severity of diarrhea. Your healthcare provider and a registered dietitian can recommend a specific eating plan. /r/n/r/n It's important to eat foods that contain probiotics to replenish the gut with good bacteria for those with C. diff, particularly if antibiotics have been taken long-term. A 2018 review study found that using probiotics helped to reduce diarrhea in those with C. diff without any side effects. /r/n/r/n Probiotics can be found in fermented foods, such as /r/n/r/n It's important to ensure that fermented food products do, in fact, contain live cultures. Probiotic-rich foods such as yogurt and kefir should not contain sugar, because sugar promotes the growth of bad bacteria in the gut. /r/n/r/n An over-the-counter or prescription probiotic supplement may be beneficial. Studies show mixed evidence that specific probiotics, such as Saccharomyces and Lactobacillus species, speed up the recovery of C. diff. /r/n/r/n A combination of Lactobacillus acidophilus, Lactobacillus casei, Saccharomyces boulardii, Lactobacillus rhamnosus, and other species in a dosage of more than 10 billion colony-forming units, taken each day, may be effective. /r/n/r/n But be sure to consult with your healthcare provider before taking any type of supplement. /r/n/r/n There are 2 types of fiber, soluble and insoluble. /r/n/r/n Studies have shown that eating a diet H insoluble fiber may help to eliminate C. diff and other types of bacterial infections in the bowel, sooner than a diet high in insoluble fiber. Foods that contain soluble fiber include /r/n/r/n Some experts recommend taking banana flakes, available in a supplemental form, to prevent diarrhea. Bananas have pectin, a soluble fiber, which may help to slow the emptying of the gut and decrease the urgency/frequency of diarrhea. /r/n/r/n Banana flakes can be purchased at a local pharmacy, but it's important to consult with your healthcare provider before taking banana flakes, or any other type of natural supplements, particularly for those with C. diff. /r/n/r/n Try these cooking tips to help alleviate diarrhea. /r/n/r/n Adjust temperature. Very hot and very cold liquids and foods may increase the frequency of diarrhea. Try eating and drinking foods and fluids at room temperature to help to control diarrhea. Everyone's body is different, so experiment with the temperature of foods and fluids to find out what works best. /r/n/r/n Try cooked vegetables. Instead of eating raw vegetables, try cooking vegetables until they are soft to lower the fiber content. Steaming or boiling, for example, may break down some of the fiber content. /r/n/r/n Try juicing. Using a juice extractor, which removes the pulp, will dramatically lower the fiber content in most foods. Note that pureeing and processing foods in a blender or food processor to make smoothies or sauces is not known to significantly lower the fiber content. /r/n/r/n Peel foods. Removing the peel from fruits and vegetables, such as apples, peaches, and potatoes, makes the insoluble fiber easier to digest and more suitable for the C. diff diet. /r/n/r/n Limit cooking oil. Avoid using cooking oil whenever possible because the extra fat may worsen diarrhea. /r/n/r/n Some research suggests that honey may be helpful for reducing bacteria in C. diff infections. However, if you are going to eat honey, make sure you are using a product that does not contain artificial sugars, which can worsen diarrhea./r/n/r/n Eating small amounts of foods and fluids frequently throughout the day is recommended for those on the C. diff diet. Large meals or snacks may increase diarrhea stools. /r/n/r/n An excessive amount of fluid may be lost when a person has chronic diarrhea. Along with the water, some nutrients and electrolytes are lost. Examples of modifications that may need to be made on the C. diff diet include the following: /r/n/r/n It's important to drink small amounts, such as half cup, of fluids frequently throughout the day instead of gulping large amounts of water. Drink fluids throughout the day. Do not wait until you feel thirsty. /r/n/r/n Tips for getting extra fluids include eating/drinking plenty of. /r/n/r/n Don't take salt pills and always consult with your healthcare provider to inquire about the need for potassium supplements. /r/n/r/n The C. diff diet should be implemented until your healthcare provider gives the all clear that the condition has resolved. The diet may be continued after a bout of C. diff as a prevention measure to keep the bacteria from regrowing and the condition from recurring. /r/n/r/n Once your registered dietitian or another healthcare provider recommends discontinuing the diet, gradually start to add back the foods you were once accustomed to. This gives your digestive system time to adjust to those foods again. /r/n/r/n It is not uncommon for those who contract C. diff to get it more than once, so it's important to take steps to prevent the condition once you heal from C. diff. /r/n/r/n According to the Academy of Nutrition and Dietetics, the most important thing to introduce into your diet are friendly bacteria, or probiotics, that will help repopulate your gut and crowd out the potential for regrowth of the C. diff bacteria. /r/n/r/n A long-term C. diff diet is not recommended because the foods may not supply enough of the nutrients needed on a long-term basis. /r/n/r/n Also, malabsorption of nutrients is a common side effect of C. diff. It's important to receive close medical intervention to ensure levels of sodium, calcium, magnesium, and potassium are normal. /r/n/r/n Look for foods high in these nutrients and follow your healthcare provider's instructions closely on when to start back on a normal diet to ensure adequate nutritional intake. /r/n/r/n Whole milk and whole milk products are known to cause stomach upset. A person who has C. diff is more likely to have trouble digesting lactose. Using a milk substitute, such as oat milk, may be recommended. Other tips for substituting milk products on the C. diff diet include the following: /r/n/r/n In some instances, C. diff symptoms are mild, but that's not always the case, so prevention is key. /r/n/r/n The Centers for Disease Control and Prevention notes that C. difficile has become the most common microbial cause of healthcare-associated infections in the U.S. and infections cause immense suffering and death for thousands of Americans each year. /r/n/r/n antibiotics are known to destroy the good friendly bacteria in the gut. Friendly bacteria are instrumental in fighting off infections in the colon, such as C. diff. Foods that replace the good bacteria in the gut, such as fermented foods and those with probiotics and probiotic supplements, may reduce the risk of developing C. diff. /r/n/r/n for people at high risk of getting C. diff due to antibiotic use, foods and supplements that have probiotics have been found to be effective. /r/n/r/n A 2018 study of adults and children who were taking antibiotics and co-administered a probiotic supplement showed a lower risk of Clostridium difficile infections. The study authors concluded that moderate quality evidence suggests probiotics are associated with a lower risk of C. difficile infection. /r/n/r/n People with C. diff or taking antibiotics should consult with their healthcare provider, registered dietitian, or another medical professional before taking any type of supplements, including probiotics or fiber supplements. /r/n/r/n Some digestive problems worsen with fiber supplements. /r/n/r/n A C. diff infection may benefit from a diet that contains foods high in soluble fiber and probiotics while avoiding foods high in insoluble fiber and fat, as well as highly processed foods. /r/n/r/n The C. diff diet should be followed only until the infection has resolved. Follow your healthcare provider's recommendations during a C. diff infection as well as when to return to a normal, balanced diet to ensure adequate nutritional intake. /r/n/r/n The purpose of THEC. Diff diet is to help control diarrhea, restore good gut bacteria, and prevent or alleviate dehydration. To help maximize the impact of this diet, focus on choosing foods with a high nutritional value that are also easy on the stomach. Sometimes the diarrhea associated with a C. diff infection may become chronic. If that is the case, your healthcare provider might recommend a multivitamin or other nutritional supplement to ensure that you remain adequately nourished while you recover. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.